brought all the other kids in the neighborhood on it so they get inoculated. Natural immunity provides 27 times better effectiveness of blocking your infection for COVID-19 than it does getting the vaccination. 27-fold better immune response by getting the natural infection. Just a little hat that you might want to pack into your hat. Let's talk about prophylaxis next. What are the prophylactic things we could do to help us with this pandemic? It's to advise your patients and yourself and your family to pick up a $20 pulse ox monitor fingertip device and keep it on hand. It was the gauge by which to decide if it's time to go and seek medical attention. And make sure you didn't have fingernail polish or false nails on your finger when you applied it on. It has to be with the, the naked nail bed, or apply it to the side of the finger, sit on top of the nail. So that's the first thing that should have been done. And one of the hospitals I went to, they actually passed these out and leased them out or rented them out to patients and when they came with the COVID diagnosis or symptoms. They told them basically, as long as you're 95 and above on room air, you're good to go. You're in a good zone. You're green to go. If you drop below 94, you go between 90 and 94 on your SaO2s, then it's time to seek medical attention, make a call, come into a clinic, or possibly even go to the emergency room if you have, certainly if you have more than a handful of comorbid conditions on top of the infection signs and symptoms. The thing that wasn't put out and acknowledged right away was the fact that vitamin D had a dramatic impact on prophylaxis. As we had learned many years ago that most of Americans are vitamin D deficient. And that's true, particularly in the Midwest. Anybody is at the 45th latitude and above does not get enough sunshine and outdoor exposure in our life to generate vitamin D sun exposure. With this study proved in September of 2020 is that patients who had vitamin D levels approaching 50 nanograms per serum levels approaching 50 nanograms per milliliter of D3 skated through this infection. And there I show you the graph that shows the mortality from the COVID-19 infection and as it relates to the serum levels of vitamin D. And look at above 40 and certainly at 50, these patients did not require hospitalization, ICU, or intensive care. Those of you that were in the know, you were telling your patients immediately, start getting their vitamin D levels up. Our recommendation for vitamin D is grossly underestimated. The original, what an international unit of vitamin D is, what one international unit of vitamin D represents, is that's how much vitamin D it takes to keep a rat from getting rickets. And so they extrapolated back in the early 1900s that if it takes one international unit of vitamin D to prevent rickets in a rat, it must take about a human being's 400 times bigger than a rat. So it must take 400 international units to keep a human from getting rickets. And so for many decades, the fundamental recommendation for vitamin D supplement was 400 international units a day. I'm here to tell you it should be much higher than that. It should be basically it should be 1,000 international units for every 10 kilograms of weight. So the average female should probably be taking around 5,000 international units a day, and the average male should be somewhere approaching 10,000 international units a day. And then you're monitoring their levels and make sure they achieve absorption and get their vitamin D levels up to 40 to 50, preferably range, as being normal. Most labs say 30 is normal. I'm telling you that you want to be higher than that. You want to be 40, 50. And as long as you're not severely above 100, you're still in a very safe range. It protects you not against this virus, not only against this virus, but many other infections and complications that can occur in your health. So here's a mechanism of how it works. Vitamin D3 interferes with renin and the conversion of angiotensin to angiotensin 1. It also blocks angiotensin 2, causing the cytokine storm and tissue injury. And so by having adequate levels of vitamin D in circulation, you provide tissue protection and you impair the reproduction process of the COVID virus inside your system. So it's probably the best prophylaxis is the vitamin D3 to have on board. 10,000, I think, is 200 milligram. I don't usually ever think of milligrams. I always think in the international unit equation.
An article from Harvard that published February 28, 22, absolutely does not support what you're talking about.
I know.
So how could somebody, I'm not for concept.
No, that's not all.
The discussion. How can somebody as a scheme that doctors around the world follow completely and have studies, and then you look at that journal, the nutritional DOI or whatever the heck that is, never heard of that journal to substantiate any type of medical reason. So if I'm a physician and I'm taking care of my COVID patients and I want to support myself medical legally, I have to support myself. I'm not a guy in a lab who's sitting there doing the data. And all of us are the same. We just sit here and we parrot the same information. And I'm going to sit there and say, I'm following New England Journal of Medicine. I'm sorry. If you want to take vitamin D and get COVID, it's up to you. But I'm not going to tell my patients take vitamin D3 and don't wear a mask and do whatever the heck you want. I don't know how to justify that. I'm
not espousing data. I'm just giving you what's been the experience in 2 years.
But how do you define when New England Journal says something and it's published just within this month or a month ago? And how do you justify that? And you have a nutrition magazine. I mean, who
well,
reads that magazine?
I will represent back to the original studies that came out of Saudi Arabia that looked at nearly 200,000 patient reports on mortality of COVID-19 in their population in Saudi Arabia. And those patients who had a serum level less than 20, had extremely high mortality rates. And it's mostly the women because their wardrobe they wore where only allows this much of their body to be exposed outside their home. And so it proved without a doubt that if you had low serum vitamin D levels, your risk were going to be higher for a bad outcome, without a doubt.
I would recommend vitamin D. I just want to make sure that my patients don't all of a sudden liver disease from excessive fat-soluble vitamins that they take from GNC.
I agree.
I've got a question for you guys, everybody here. What do you think about vitamin D? What do you think about vitamin D and cancer? Is there a correlation?
Across the board, it should not have been called vitamin D. It should be called hormone D. It's a non-sex hormone. And that it basically, we did learn in school the ADEK problem of having fat solubility of these vitamins, and they could get over accumulation and cause health issues. But again, that only occurred extremely high levels that were so when you recommend these higher levels for patients, you're certainly obligated as a healthcare provider to check their serum levels and make sure, first of all, they're adequately absorbing. It's amazing to me how many patients are taking extremely high levels and never got adequate serum levels. You had to resort to drops, sublingual drops, or even injections of vitamin D.
Let me tell you a personal story, another one. So 20 years ago, my vitamin D was 5. Okay, I'm in the sun all the time. I drive a convertible. I'm in California. I'm always tan, so I don't really think vitamin D you get from the sun. But guess what was wrong with me when my vitamin D was 5? Cancer. You guys who picked it up? This guy. I was being scoped every 2 years at UCI. They thought it was a leiomyoma in my esophagus. So when he said it could be cancer, I said biopsy it. And sure enough, I had just tumor. It's a good thing that we found it that way because I would have been dead. I really think vitamin D has a lot to do with cancer also.
I did a functional medicine program about 14 years ago, a 2-year functional medicine program. And I mean, one of the biggest things I got out of that is that what people don't realize, number one, as you say, D is a hormone. The amount of overdoses of vitamin D in the medical literature in the last 30 years is almost insignificant. I've seen patients at 200, 250, and go, oh my God. One of them, her leukemia got better. But I mean, there is no question. And what this doctor says about the New England Journal of Medicine, number one, if any of you see Dope Sick on Hulu, you're going to learn. I mean, there's things that you learn. These journals it's not God. It is not like the Bible. They're the pharmaceutical industry. What they're able to do medically and in journals and stuff is they want people writing for drugs, not nutrition, And like, for example, I don't know how many people use the Merck drug to treat COVID, but you don't hear much about it in the medical literature. You don't hear much about it in the PR, just that it's only available at Myers Specialty Pharmacy and the Pfizer, both of them. You don't hear much. How many of you use the Pfizer and Merck drugs to treat COVID? Who in this room have used those? Anybody? You've used it? And how well has it worked?
Even a study that I've seen have, again, we don't have any studies to say if it's doing well or not at this time, because it's really new.
I personally don't even think that drug should have been even approved by the FDA. I don't think there's enough data to prove that they were even effective. They're pushed through on this experimental, a lot of things feel that way about the vaccine too, but time will tell.
Reason I chose this particular article because this was the best schematic I saw of why vitamin D works in slowing down the virus and protecting you from the virus as prophylaxis. And by the way, it was September of 2020 that in front of Congress, Dr. Fauci announced that he was taking vitamin C and vitamin D supplements to protect himself. September of 2020, 9 months into the pandemic, or 8 months into the pandemic, he finally tells what he was doing for himself. And the mechanism of action is well explained, well delineated. And by the way, nutritional journals, I will take that over to New England Journal of Medicine any day as far as nutritional education and whereabouts. In our average medical school in America, we receive 10 hours of nutritional education, 10 clinical hours of nutritional education. And I give a talk on nutrition and health. And it's a skeleton in our school's closet, is the fact that we're not teaching nutrition and the benefits of it for our patients it may represent. Zinc is another supplement that has importance, especially we found out that with the case of hydroxychloroquine and chloroquine phosphate, that zinc acts as a zinc ionophore. What does that mean? It means that in the presence of chloroquine or hydroxychloroquine, it actually helps move the zinc intercellularly into the person's tissues. And this provides a benefit. And there's a reference article to that original proof of that. That was in 2014. We were aware that zinc can be pushed intercellularly by the use of chloroquine products. Significance of that, where does zinc fit in? Whether you take zinc supplements, you take the cold remedies that have zinc added to the ingredients, that part of that. It works by that once it goes intercellularly over here, the zinc goes in the ionophore, it goes inside the cell. It comes over here and it blocks viral replication. So it slows down virus replication. So the earlier, the better. You don't wait till someone's on a ventilator, gasping their last breaths, and then you add in zinc or you add in hydroxychloroquine. And they had the abysmal failures by all the journals, which one was redacted by the Lancet, who proclaimed that hydroxychloroquine was lethal. And then they retracted that article within less than 30 days for falsifications. It also blocks the furin attachment site for the virus, which slows down the viral movement intercellularly as well. So for several reasons, zinc alone is an important supplement to include. We know that for many years. We've been telling people to take zinc supplements and tablets and lozenges to help with cold symptoms. That's nothing new for all of us. And that's where it works. It works even better if you have something like hydroxychloroquine or chloroquine on board to enhance this process, because most people, like I said, with vitamin D are also zinc deficient. And all those studies that looked at the efficacy of hydroxychloroquine and chloroquine products on the treatment of COVID-19 did not address zinc supplements or check the baseline zinc levels. So you're only getting half the equation in prophylaxis. So the potential intervention of SARS-CoV-2 infections in a medical journal of virology showing zinc showed promise. This article was published in September of 2020. When is hydroxychloroquine dangerous? Late in a disease. If your patient has elevated CK enzymes, elevated troponin levels, they're having chest pain, they're showing signs of having myocarditis, you do not want to be using hydroxychloroquine because that's when it can prolong the QT interval and they have a PVC hit on that QT interval prolongation and get to SARS de points VTAC, which is a very difficult refractory form of VTAC that can cause death. So once again, you do not wait till people are severely hospital ill. If you're going to use hydroxychloroquine to treat fever, aches, and pains, and the early symptoms and help slow down the virus process, if you opt to do that, if you're even allowed to do that, if your pharmacy will even fill your prescription for you, because most of the box store pharmacies would not fill our prescriptions on request for hydroxychloroquine. Another article stating that the zinc supplements enhance the clinical efficiency of hydroxychloroquine against the battle of COVID-19. And the conclusion is, yes, it does. That article came out in October of 2020. The science was there. It is there. This one is observed over nearly 250 patients that were mechanically ventilated with COVID patients at the beginning of the pandemic, and it showed that there was improvements in patients who received both hydroxychloroquine and a zinc supplement to their survival rates. But we've been told to avoid that. This article was published in August of 2005 during the first SARS-1 epidemic. 2005, we've known this for a while, that chloroquine is a potential inhibitor of the SARS coronavirus infection and its spread. Who's manipulating the mass media? I'll let you look at the commercials yourself and see who's manipulating those medias. Okay, let's talk about testing. How many of you have been tested for COVID-19? I get a show of hands of virtually 100% of us have been tested. How many have experienced the pleasant PCR test up your nasal passage and had your pituitary tickled? Okay. How many are aware that the CDC redacted the PCR test in July of last year? Only a third. How will that get out? You're still doing a PCR test. I don't understand this sometimes. Wasn't this a fun thing to do? Uncomfortable. It was reliably unreliable. Once again, it was reliably unreliable. If anyone knows the science behind doing a PCR test, you're looking for DNA fragments of the particular organism you're looking for. When they first created the PCR test, they used the common cold coronavirus. They didn't even use the SARS-CoV-1 to make the test. They've done the cycles, and the more you repeat the cycles of the analysis, the smaller and smaller fragments of the DNA can you detect. You're picking up dead virus remnant particles. The cycles were greater than 40. The cycles that were first put out on the nasal pharyngeal PCR tests were 42 to 45 cycles. That means you're going to find it in a lot of people as a false positive. How many are you aware that the CDC last year reduced the cycles down to less than 20 at the change of administration? The cycles are now less than 25. Yes, sir. You knew that. Why was that done? What would that do to the results of showing positivity? It cut them in half. It showed less cases. It showed less cases just because you reduce the cycle analysis. So the communication about the accuracy of these tests has been poor at best. To those of us who need to know this information are not informed. What really works best, and what this is espoused to by the CDC now, is to do serological testing, finding the acute phase reaction with IgM and SARS-CoV-2 antibodies in circulation. It takes about a week for that to show up. So you've been infected here or exposed here, and by your first week of symptoms, your IgM molecules start climbing. And that's how you know you've been exposed and you had an immune response to a COVID-19 infection. And then shortly behind that comes the IgM, which lasts for a longer period of time. I should say the IgG, I apologize. IgM is a first response that lasts for about anywhere from 4 to 6 weeks, stays in circulation, then it disappears, and it switches over to the IgG response, which lasts out to anywhere from, now they say 6 months to a year.
I have a Quest laboratory in my own office for my own practice.
I don't see.
Right here. I have my own Quest lab just for my own practice. I have a practice where I have 6 health providers. And the IgG, IgM test, I have found to be so disappointing and so inaccurate. It doesn't make any sense to me. I look at it, and first of all, people who've had COVID, positive PCR test, their IgG is negative. It almost seems like it's a scam.
Yeah, it's all over the place. It is all over the place, and I apologize for it. Yeah. But that's where the CDC went on July 21st, 2021. Laboratory alert, they changed, they pulled back the PCR recommendation, and they recommended SARS-CoV-2 testing serologically. And that's where our leadership is right now in the healthcare recommendation. And that's the official CDC report flyer that went out, which I had to hunt to find this. Have you seen this anywhere in the health departments or in laboratories? Acknowledgements? I haven't. How many people know Dr. Carrie Mullis? Anybody aware who this person is? This is the inventor of the PCR test. Dr. Carrie Mullis. This is a presentation he gave in the summer of 2019. After this presentation, he died a few weeks later, unexpectedly, of pneumonia.
What is it? What is it about humanity that wants to go to all the details and stuff and listen? These guys like Fauci get up there and start talking. He doesn't know anything really about anything, and I'd say that to his face. Nothing. The man thinks you can take a blood sample and stick it in an electron microscope, and if it's got a virus in there, you'll know it. He doesn't understand electron microscopy, and he doesn't understand medicine. He should not be in a position like he's in. Most of those guys up there on the top are just total administrative people, and they don't know anything about what's going on the bottom. Those guys have got an agenda, which is not what we would like them to have, being that we pay for them to take care of our health in some way. They've got a personal kind of agenda. They make up their own rules as they go. They change them when they want to, and they smugly, like Tony Fauci, does not mind going on television in front of the people who pay his salary and lie directly into the camera. You can't expect the sheep to really respect the best and the brightest. They don't know the difference, really. I mean, I like humans. Don't get me wrong, but basically, the vast majority of them do not possess the ability to judge who is and who isn't a really good scientist. I mean, that's a problem. That's a main problem actually with science, I'd say, in this century, because science is being judged by people. Funding is being done by people who don't understand it. Okay, who do we trust? Fauci? Fauci doesn't know enough to, if Fauci wants to get on television with somebody who knows a little bit about this stuff and debate him, he could easily do it because he's been asked. I mean, I've had a lot of people, president of the University of South Carolina asked Fauci if he'd come down there and debate me on the stage in front of the student body, because I wanted somebody who was from the other side to come down there and balance because I felt like, well, these guys can listen to me, but I need to have somebody else down here that's going to tell me the other side. But Fauci didn't want to do it. That's not an epidemic. The number of cases reported went up epidemically, exponentially, because the number of tests that was done went up exponentially. How many doctors knew about HIV in 1983? 2. How many knew about it in 1985? Say 500. How many knew about it in 1986? 40,000.
So the inventor of PCR is telling them that PCR should not be used to look at these viruses. That was in the summer of 2019, before the pandemic was even announced. And after he made those statements there, they were pretty harsh about our leadership. He dies of pneumonia in August. I don't know. I don't know. But he's not there. What happened to the flu? What happened to influenza? It disappeared. Or did we shift the diagnosis of influenza over to the SARS-CoV-2? So it just went away. And there's the numbers. The average flu season for the last decade has been about 30,000 deaths. Sometimes it spikes higher to 60,000 deaths in a year. In 2020, it went down to less than 10,000 deaths. In 2021, influenza was virtually non-existent. And that's the CDC numbers, case reports on flu death, COVID deaths, et cetera. Source the CDC in their own words. Where'd it go? Was there incentives to make a diagnosis of COVID-19 in the hospital setting? Yes. What that incentive represent to the hospital? On average, it represented the $13,000 kicker to the bottom line of what they got reimbursed. If the patient went on to invasive and mechanical ventilation, how much more did the hospital capitalize on average? Anywhere from between $30,000 to $60,000 more for the case. There was a bounty put on the diagnosis, and that's the truth. Vaccinations. We talked about vaccinations. What should they represent? Well, did anyone know that we changed the definition of vaccination last year? For the first time in 3 decades, we changed it. Since vaccines were invented, but CDC decided to change the vaccination terminology, what it means. They took out the word immunity, and they took out the word protection from disease out of their own literature. So I did comparisons side by side. You can read in detail. There's the old language above and the new language below. There's a CDC, after they realized COVID-19 vaccines that were introduced, that they discovered they do not necessarily prevent disease, or do they provide immunity? So they had to amend their own nomenclature of a vaccine. And so that Merriam-Webster dictionary MWD definition was changed as well in our literature data bank. Now, isn't it amazing? What did President Trump say? That we're going to address this with warp speed, address this vaccination production process. How long does it take a traditional vaccine to come to market? At least 10. We did it in less than 10 months through emergency utilization authorization rules that flied out. And so what I show you here is, here's the first case reports out of China, December 31st, 2019. And by December of 2020, the first emergency utilization authorization was released for AstraZeneca's product. That was actually over in Europe and not in the United States. It was not promoted heavily in America. Pfizer came on its heels a few days later and offered their messenger RNA immunization. I hesitate to call it a vaccination. My term I came up with is an immunogenic injection is what we're receiving. Over here in the far column is what these companies have made since their vaccines have been approved for emergency use. AstraZeneca has made 4 billion. Pfizer has made 36 billion as the end of last year. Moderna has made $18 billion on their vaccine. Johnson & Johnson has made a modest $3 billion. How many of you know that Moderna's real name of their vaccine is called Spikevax? And then we did get FDA approval for one. Comirnaty was a name that they came up with biotech in collaboration with Pfizer. They called their version of the vaccine, they got the approval as Comirnaty, which is a portmanteau of putting these words together: community, immunity, COVID-19, messenger RNA, is where they came up with that combined word. Like the kids do, like they say ginormous. They put gigantic with enormous together. So that's where they came up with this. Now, it received FDA approval, but the truth of that was the approval was in Europe and not the United States. Anybody have access to this version of Pfizer in their practice world that you're aware of? That's the only one that's FDA approved. That was August 23rd, 2021. So how is it that we had on the shelf that what usually takes a decade to produce a new vaccine, we produced 4 vaccines in 10 months? That means that these were already in research and development. They were already on the shelf and ready to go. That's the only conclusion I can come up with. Where did the deaths occur? And as I said in my original presentation 2 years ago, thank God it spared the young people. Thank God it spared the children. It spared the infants, the preschoolers, those in school, those that are in college, those that are younger than the age 45. So the mortality rate, 75% of those people who died since this virus was first on our continent, 75% deaths have been over the age of 65. Right there, those 4 columns. Now look at the death rate for those people under the age of 40. Only 2% of the deaths have occurred in those people under the age of 40. And where have we been slamming the message about vaccination to? Kids in school. They started out with a recommendation when they got their first emergency utilization authorization, 18 and above were eligible to receive the vaccine, especially those people with high risk factors. Do I believe in vaccination? Yes, I do. I'm not a non-vaxxer. Do I believe I'm a child of the smallpox vaccination and polio, thank God, that kept me upright and not disabled.